Good afternoon and welcome to the Health Committee for the County of Renfrew. This was, of course, to have been yesterday, but was postponed to this afternoon in recognition of yesterday's observation of Remembrance Day. So thank you to everyone for being here today. Ms. Gruntz, I understand Ms. Johnson, I understand that the roll has been called. Can you confirm?
Yes, it has been. Thank you.
Thank you very much. I would invite now at this point, committee, any disclosures of pecuniary interest, and if so, the general nature thereof. I recognize none. With that, can I have a motion to adopt the minutes of the previous meeting held October 14th, 2020, please? Councillor Murphy, seconded by Councillor Lafreniere. Any errors or omissions? All in favor? That is carried. Thank you. With that, then I am going to invite, very excited by today's delegation. It has been much time in the works. Looking very much forward to today's presentation. Perhaps Ms. Sheedy, if you could introduce our delegation.
Thank you, Mr. Chair. I'd be happy to. Good afternoon to members of Health Committee as well as Social Services. So we have with us today Ken Foltz and Scott Robertson from Refact consulting firm, who were the successful proponents for our seniors strategy that we embarked on earlier this year. So very pleased to introduce them and invite them to give you an update at this point in time, knowing that they will be coming back to these two committees and council in the new year with actual recommendations. But today's purpose is to give you an update. Thank you, Ken and Scott. I know you're going to be, Sean has your presentation, so he will be sharing the screen, and take it away when you're ready.
I think that would be
Sean, it's now done.
All right, thank you, Rose.
All right. Well, thank you very much for inviting us to share this update with you today. We're very pleased to be with you. For the brief period of time we have with you, we'll be giving you some highlights of the work that we've done to date and provide some general directions on where that work is headed. As mentioned by Shelley, we will be returning back first thing in the new year to talk in detail. Obviously, given the scope of what we're looking at, there's quite a bit of information to go through, certainly more than we could in the small time allotted today. So I'll be taking you through these findings in fairly short order. The study objectives and process, just as a reminder, the general objective was to really look at seniors' housing options, how to expand those options beyond the brick and mortar options that exist in the county today. As you'll see in a moment, we're looking at a fairly wide spectrum in terms of what that seniors' housing means, along with just more than just bricks and mortar. But in terms of our general process, we outlined on the right-hand side here the scope of work that we were engaged to do. So really looking at the housing needs and supply, the services needs and supply, to understand the broader context that both of those environments are working in, to look at some options and expand housing services, and then to recommend strategies to capitalize on the best options. We'll be talking today mostly about those first three items and giving you a sense of where number 4 and 5 are going. So with that said, in the next slide, what you can see here, what we wanted to do is give you a little bit of a map to understand. And again, it's a little bit harder to see some of the details here, but I'll quickly walk you through this. We understand that seniors from a brick and mortar point of view choose to accommodate themselves in a wide range of living environments. So if we look at the bottom here, we can consider seniors that are quite independent, don't require too much assistance with ADLs, activities of daily living. and don't require a lot of supports. Semi-independent seniors in the middle would be, moderately independent, but do require some assistance. They may require care, but it's not needed on an intensive basis, or it can be occasions where they just need little top-up bits of service to assist. And then you get to the dependent seniors on the right-hand side here, who are highly reliant on assistance. In these instances, care is needed on a 24/7 basis. So when you start to think about the housing environments that seniors live in, given this spectrum of capacity, you'll get some of those traditional housing options on the left-hand side, whether it's traditional home ownership or rentals, life lease, co-housing, in-law suites, basement apartments, community housing, or adult communities. And most of those are in the market part of the housing. So they would be private sector, although when it comes to community living, you might have nonprofit housing providers or alternate arrangements. As you move into that semi-independent area, you're going to get slightly different housing models where you get congregate living, things like Abbeyfield model, for those that you are familiar with it, where there is some shared space and seniors would live together. There's other supportive housing environments where there's supports resident on site. That's an assisted living facility. Others where supports are brought in on an ongoing basis. And then retirement homes would generally fall into this category as well. That said, some retirement homes do provide higher levels of care and would bridge some of these categories. As you move into the right-hand side where you have seniors who require considerable care, you're now talking about long-term care homes, whether those are municipal or private. And ultimately on the right-hand side, it's hidden a bit by the panel there, but you would get into hospital stays for those who require it. There are also campuses of care that you might be aware of out there who might offer some of these housing opportunities all the way along the spectrum and provide that all on one sort of campus area. So this gives you a sense of what some of those housing opportunities are across that spectrum. Now, if we look at the next slide, using the same spectrum of seniors' needs, if we look at the type of supports that they might need, we can also group these into categories. So for those who are more independent, it might mean some basic services that are out there in the community, whether that's friendly visits, meals on wheels, things of that nature. So low intensity services, but intended to help people maintain their independence. As you move into that semi-independent area, the level of services and supports tends to increase. So you could have attendant care, whether that's provided in home or in a facility, if that's where they tend to reside. Same thing with supportive housing or assisted living situations. You would also have a program like you have with community paramedicine, where those supports can be provided in-house as well. The other opportunities there that are geared to those who assist people providing those supports at the bottom would be caregiver and respite care. And those are really intended to assist, say, family members who are providing that care with the supports and the relief that they might need from time to time. As you head over into the dependent category, there's obviously a high level of specialized care and supports, whether it's related to nursing care, dementia, social programming, or in some cases palliative care. For those that are discharging from the healthcare system, there's also a discharge planning, which would lead you into that respite care envelope. So as you can see, there's a spectrum of supports, a spectrum of housing needs. The next slide sort of puts those two pieces together, because we know that intrinsically seniors' needs are linked both to the brick and mortar and to the supports they need. So this gives you a sort of a sense of the map of options out there available in terms of that. The other thing I think that's important to note is that if we think about the left-hand side in terms of independence, If we want to talk numerically, this is where most of the seniors in the community are going to find themselves. They're quite independent. They don't need a lot of services. As we move to the other side of the spectrum, those numbers diminish significantly. So if you think about people who are sort of in their own homes, in private households right now, that's a little over 90% of the seniors in the county. The residual being those that would be living in a facility that's congregate living and or a care facility. The other thing that's just helpful to note before we move on is that the county has a direct role in some parts of these continuums, as you know. So for instance, on the housing side, Renfrew County Housing Corporation does provide community housing, and there are community providers that do that as well. Some of those are designated specifically for seniors. You have over on the right-hand side long-term care facilities, and as you know, you have two quite sizable long-term care facilities that you own and operate. So all that, and in between there are some areas of care or programs that you deliver out of those facilities in terms of supporting people, and of course the paramedicine piece as well. So there are elements on the spectrum where the county has a direct role in terms of providing supports to seniors. So let's talk about seniors' needs for a second, just to get a better sense of what's in the community if we move to the next slide. As per the last census, we know that there's about 21,000 seniors by population in the county. So that would have been as of 2016. And that translates to about 13,000 households. So the distinction there is that when you're counting heads, we're talking population. Households, it could be couples and other family structures. So the reason we are interested in households because that translates into housing needs. So that's an important metric. When we look at the statistics here, one of the things we know is that over the next number of years, there's going to be an addition of about 8,000 to 10,000 what we would call new seniors. So that's people either living here that age in place. There'll also be some new people who come into the county, albeit it's likely to be quite small. But that's in contrast with the fact that the population growth over that time period overall is projected to be quite flat. So while the county won't grow significantly in terms of numbers, it will age significantly in terms of that. So we know right now that seniors make up about 20% of the population, and within that next time frame, up to 2041, it'll be something like in the order of 28 or 30%. So that's significant. We know that those populations, not surprisingly, are concentrated in some of the larger settlement areas. People are tending to stay home. Household sizes are smaller. That's a trend that's happening all across North America. It's not just something happening here or with seniors. It's happening with the population as a whole. The other important thing from a housing need perspective is to understand affordability issues. So just so we're clear on what that means, the most commonly accepted definition is that if you're spending 30% or more of your gross income towards housing, then you would have an affordability problem. On the basis of that ruler, we know that about 20% of seniors have an affordability issue in the county. And it's very acute for renters. About 56% of senior renters spend more than 30% of their income on housing. So that's quite notable. Not so different from other areas, but certainly notable in terms of the accommodation requirements they have. The other thing we know is that we're talking about seniors as a general group using the typical measuring stick, which is 65 years or older. As seniors age in time, their living structure in terms of movement towards living alone and those affordability issues tend to increase. And as we're living longer, more seniors are falling into those categories, which is something to be mindful of. On the support service side of things, we know that there are sizable waiting lists for long-term care facilities right now. It's approaching 850 individuals, unique individuals within the county. predominantly again in those larger settlement areas. There can be significant placement times, and it can take a number of years. Some of the metrics are a bit challenging to relate to. They use a metric related to the 90th percentile, which basically 9 out of 10 people would fall into that category. But again, I think the biggest thing here to note is that because there's a significant wait list, there's not much turnover, and there's a substantial demand for the units that are there. Interestingly, of those on the wait list, about 1/3 are in lower need. So they're not sort of critically or imminently needing it, but they are on that wait list. The reason this is important is because those individuals might be able to be better served in the community as opposed to in a long-term care facility. We also know that there's a high demand for community care out there in the community for those people wanting to live at home. The general figures that we've been able to pull together through the LIN and through the support providers are that there's been about, in the most recent fiscal year, about 3,000 referrals for service, depending on those things. And this could be things like respite care, home care, physiotherapy, nursing care, things of that nature. Typically, those folks tend to receive their care in a timely way. I think the numbers we saw is that there's an average of about 57% of those folks get their care within 5 days. But there are some folks who, because of the needs they have or where they are, or the nature of the available services, tend to wait a lot longer. The other thing we know is that, like the long-term care wait list, there tends to be only a certain portion. In this case, it's only about 37% who have chronic or high needs who are consuming those services. So there's a fair amount of people that just need a moderate level of support to stay in the community, which is, again, newsworthy. So the big takeaway here for us is that, you know, you're going to have a growing seniors population, and with that will come growing needs in terms of supports. The question inevitably becomes where best to provide those supports and meet those needs. So the next slide, we talk a little bit more about what realities seniors are facing. So we've given a bit of a feeling for the needs. The next question is what realities they're facing in terms of housing supply and services. We know that most of the owners, seniors owners, there's about 80% of them that are in single detached. Of the senior renters, most of them live in apartments, but there's a good chunk, about 32%, that live in different types of housing stock. So one of the interesting things about your rental stock in the county is that there's a high proportion of housing stock that we would call secondary. That is, you know, rented out single detached homes or semis or things of that nature that aren't traditional rental structures. We would call them informal rental stock. It's noteworthy then that 32% of your seniors are living in some of those sort of less formal rental arrangements. Generally, the stock is in good shape. The interesting thing that we've seen in the numbers is that, and I don't think this would be a big surprise, is that in terms of the housing that's coming online, most of what's being produced is what has always been produced. High emphasis on single detached homes, and not a lot of those options in the middle in terms of downsizing. So if you're looking for townhomes or alternate arrangements, more rental, those are much smaller in supply out there in the community, and there's not a lot coming online. The other thing we know is that from an affordability point of view, some seniors will tend to try and get access to community housing because it's inherently affordable. But we know that supply of housing has remained fairly static as well over the last point of time, and waiting lists are tending to grow in that area. So when you have that demand and a limited supply, it's not surprising then that you're going to see higher rents, lower vacancy rates, and generally more demand for those service for the that types of accommodation. On the support side, I think we know that there's currently 9 long-term care homes out there. They provide almost 800 beds in terms of service. There's another 72 coming online, so they're in the pipeline. So that's great news in terms of that. You also have a wide swath of retirement homes, 12 in all, that provide over 800 beds, although there's a high concentration of those beds in Pembroke. The community care, we've seen there's a wide array of agencies out there. So when we did a service inventory look across this, we found upwards of 22 agencies who are providing services throughout the county at a number of different locations. So again, I think what this tells us is that there's some diminishing choices for seniors here, especially in terms of trying to downsize, in terms of the wait lists for the other housing that's out there. So as seniors age and capacity diminish, there's not as many choices out there as they need. So there's some gaps in the market, and that's pretty clear. If we look at the next slide, just talks about some of the consultations we've done as part of our work. One of the things that was built into our scope was the desire to get out there and talk to community stakeholders and folks just out in the community to understand their perspectives on seniors housing. As you can imagine, when we were embarking on this in the midst of the COVID situation, it took a little bit more creative ways to try and gather that feedback, and it was over the summer as well, while people were in their traditional holidays. So it was a bit of a challenge, but the people who we were able to engage with were very forthcoming in terms of their thoughts. I think, as most are aware, there was a council questionnaire. We did key informed interviews with some specific folks who we were targeted by staff as to have key perspectives on seniors housing. We also did some focus group sessions and a community roundtable with folks elsewhere in the community who might have secondary perspectives. And then we also made available an email feedback loop on the county webpage in terms of gathering that feedback as well. So we got a good range of feedback, and we followed on about 5 or 6 main questions, really trying to understand the needs as they saw them, the gaps in the markets and priorities, what opportunities were out there to address those, the roles of the different stakeholders in the system, and then their thoughts about priorities for moving forward. So the next slide will just give you a quick highlight of some of that feedback. Much like what we've seen with the statistics and the analysis in the first part, there's a recognition that there's a lack of appropriate options out there for people to downsize and to transition out of their regular homes. We know that a lot of folks want to remain at home, but the supports aren't always there, or there's some time lags in getting that. Obviously, there's continued demand for long-term care style housing, and some of that's outside of the traditional areas, although a good chunk of it is for homes in those 3 primary or settlement areas. I think you're quite aware of the lack of primary physicians and shortages in the healthcare sector. Those are just exacerbating some of these other problems in terms of trying to respond to the seniors' needs. So that was something that was pretty clear. Affordability is also an issue that was cited both for housing and for supports. You might recall that in the case of some of those community services, there's a copay component where individuals will have to top up or pay a nominal amount. And that was cited as an affordability problem for some seniors as well. Transportation, just because of your geography, continues to be an issue. And stakeholders had some different thoughts about that. That said, I think people were forthcoming with an awful lot of opportunities they saw out there, whether it's investing in private sector housing, utilizing surplus land to do care campuses. Another interesting thought was to try and use, put higher care beds into some of those lower care settings. So in essence, using some of the vacant retirement home beds and finding a way to use those on either an interim or a longer term basis to serve some of those higher care needs. The notion of providing service nodes or hubs in the more rural areas, I think, was a very common theme that people talked about. It's been done in other jurisdictions, and I think people are aware of that. We know based on the recent announcement that you had that paramedicine pilot is expanding, and certainly people were quite interested and intrigued in watching that happen. And I think just general ideas in terms of age-friendly community planning and greater forms of accessibility were also noted. We also asked, per the next slide, stakeholders about the roles. So who should do what in the system? As you can imagine, when you saw that first slide we had, there's a pretty wide swath of landscape there and an awful lot of actors and individuals involved in that system. So one of the questions we had is, how well is that system working? And one of the things that was pretty clear is people felt that there needed to be a little bit more coordination there. So when we started asking about specific roles, they certainly had some opinions about the county in terms of being a leader in setting vision, being a catalyst in providing tools to help move things forward, and really be a facilitator in helping connect the parts. It was clear they also said there's a strong role for those in the community to be collaborating, leveraging amongst themselves, and trying to work together. And one big message was the whole notion of system awareness. So do people who provide service in the system, are they aware of the other people that provide that service? And could they help navigate someone to get that service if the service they were looking for wasn't the one that they were providing? So really that notion of a more effective system that's aware of itself. And there was an awful lot of discussion from folks about trying to get the private sector more engaged in terms of the solutions, whether that's in providing just basic market housing at more affordable rates, whether they'd like to be more involved in some of the long-term care and other elements in a more meaningful way. So the priorities for them were really about, supporting people where they are, expanding the options out there, especially ones that are affordable, making sure there's a suitable supply of long-term care and retirement care facilities, really extending those services out to the more rural areas, given the geography that you have to cover, and certainly paramedicine and service nodes would be one way to do that. I think, again, we heard time and again the notion of more system planning, more coordination in terms of the healthcare system, and allowing flexibility. And this one was important, especially when it came down to things like discharge from hospitals. So when there's not enough respite care beds out there in the community, the transition from being discharged for a hospital for a fairly minor thing without that service can then have them slipping back into the hospital because they can't go back home without that respite step. So that was another important one. And certainly engaging the community in terms of those private sector and community sector options. So the next thing I think that is important to understand to put some of these findings into context is to understand what's happening out there in the system, the broader system. On the housing side of the world, we know that there's this sort of geography of need that exists, and the communities are tending to represent themselves in terms of what they need locally, but having a more comprehensive county-wide response to that tends to be a bit of a challenge. So, and that's, again, I think, a product of your geography. There's no question about that. As we've seen from the production trends and what's happening on the ground, there hasn't been a lot of investment or interest to address some of those gaps from the private market. And that's that's an ongoing issue. And again, the geography and distribution of your population have an influence on that. Likewise, because of the planning system that you have, it's not sort of a true two-tier system. There is some disparity in the land use policies and how those can support options across the different municipalities. The other thing that we're certainly aware that the programs that are being made available by senior government, while we're thankful that those exist, you know, there's limits on what's there. So getting access to that money and actually putting it to work locally to get those housing developments at affordable levels is a challenge. The other thing we know is that right now in the community housing sector, there's a process of modernization going on. So there's some legislative ideas and changes that may yet come that could have implications for how that form of housing might be able to address the needs of residents in the future, of which seniors are one of those groups. On the service and support side, I think it's actually, there's a number of bigger challenges there. So certainly, you know, the concentrations of services and facilities within the county, given your geography, is an ongoing thing that you wrestle with. And I think you're probably quite aware of that. Same thing can be said here, you know, resources are finite, and how those resources get allocated is always going to be a matter of discussion when there isn't enough resources. That whole system coordination clarity, again, we can speak firsthand of this just in terms of doing our work, talking to stakeholders, and trying to interpret what's happening out there, that, you know, the coordination part is pretty significant. That could be in part based on this next point, which is the planning environment. So you have, you know, the LHINs basically transitioning away from the work they did. You no longer have Community Care Access, CCAC, the emergence of Ontario Health Teams, OHT, the advent of COVID, and now, you know, the sense that there's going to be long-term care reforms potentially post of COVID as well. So there's an awful lot of moving parts in the health sector right now, and that makes it hard to do some of that planning and coordination. Likewise, just to the last point here, even in the work that we were doing, trying to get a hold of good data and consistency when you have a system that's fragmented a bit like that, certainly has its challenge. So in terms of the last slide, or the second last slide, the question then is, you know, where does this start to take us? So on the housing side, just to think about that sphere for a second, it's clear that there's an opportunity to use the municipal tools that you have at your disposal, whether that's the county or local municipalities, to help incent the type of development that you would like to see, that's seniors friendly, whether that's land, grants, things of that nature. We also know that it's not only the county and government that can do that, but actually entering into creative discussions with private sector partners or community partners about leveraging their property or their assets to help work collaboratively towards something. So those, you know, those are clear opportunities that exist out there. Making the best use of those program funds that are out there to support the priorities that you have locally. That's an ongoing thing. Again, knowing that different programs rise and fall depending on the amount of funding and the time limits that they're available. Using the regulatory tools at your disposal is an important one. Typically, this is, you know, through the land use side of things, but you also have, you know, capital facilities tools available to you under the Municipal Act that can help promote this as well. There's been work done recently in terms of the update for your housing and homeless plan, and we know that because we did it. There's some specific recommendations there that are complementary here, and we certainly see dovetailing with that in terms of the strategy going forward. And certainly the whole piece of building partnerships with the community and the private sector is really quite critical going forward. There's a lot of support for that. And I think obviously a desire to try and expand the resources and weight that you can bring to dealing with the issues. On the services and support side, expanding existing facilities to create the continuum of care campuses, there's certainly opportunities to do that. We've seen examples of this elsewhere in the province that have been very, very successful and are very beneficial. The notion here is that if a senior moves into, say, a life lease or an affordable apartment on that campus, and then because their care degrades or because their condition degrades on that campus, because you have a continuum of housing options, they don't have to leave the campus. They don't have to leave their community as their life situation changes. So again, there's opportunities to consider those types of options. Building on the successes of expanding services out to the rural area. And again, I think the recent announcement about paramedicine and that pilot is going to start moving you along that direction. Likewise, similarly, the growth and collaboration on hubs and nodes. So there are areas out in those rural areas that have become sort of little hubs or nodes where services have coalesced around. Trying to think about ways to expand and offer services. So the notion there is that that critical mass becomes a base that you can build out from that local community to get their services. This also counters, the notion where, in terms of trying to find transportation to solve people all the time, putting the services out closer to where the people are to help reduce those needs. Again, the whole system coordination, positioning with regards to the Ontario Health Team alignment to really ensure that they're going to have better outcomes. These are very important things in terms of looking forward. So next slide, just in terms of our process, hopefully that gives you a sense of where we're at today. Again, I think in terms of the assessment of the needs, we've got a strong feedback and influence from stakeholders. We're now in the position of synthesizing that information, assessing possible options that can address the issues we've talked about, and then drafting a multi-pronged seniors housing strategy. As mentioned, associated with that, we'll talk about considerations on bringing that strategy forward, what's going to be involved with that, and then wrap that up in terms of the overall draft. That draft would be coming back to your committee in January, and then subsequently to County Council thereafter. With that, I'd be happy to take any questions that the committee might have.
First, I want to thank you very much for a very comprehensive presentation. I do also want to note I was remiss at the outset of welcoming those members of the Social Services Committee. I believe Councillor Brose, Councillor Reinwald, very happy to have you here. There is much overlap, which is incredibly important in this endeavor, I think, from both a social housing perspective and from the health perspective, that we have that kind of cooperation. I think perhaps the only one missing, I recognize Mayor LeMay, that you are also a member of the Social Services. I think perhaps Mr. Jacquino, Councillor Jacquino, is the only one perhaps missing. With that, I will invite any questions. I see Councillor Murphy. We will begin with you, please.
Thank you, Chair. Through you, Ken, that was really, really, really informative. Thank you so much. And I want to take you back to slide 11, where you absolutely nailed something that I've been asked about quite a bit. So going back to your, disparity in how land use is allowed in our local tiers. And I think, if I have an aging parent who is fairly independent, doesn't want to live in my house, but the only way to build them something on my property is in fact to sever and sell or give them the land. And because in Bonachere Valley, we don't allow for two domiciles on one property. So that is something that I've had, you talk about in-law suites and granny suites. That's something that I've been asked about a lot because we don't allow it. So I'm really glad that you drilled down on that. That is a very important point. I think we're going to have to make some changes to allow for people to build little bungalows or what have you on their property, so that as your seniors transition from that very independent to a little less independent, then they might have you know, their younger children right there, able to, you know, do groceries or medical appointments or what have you. So I really appreciated that. Thank you.
Thank you.
Thank you, Councillor Murphy. Councillor Brose, please.
Yes, thank you, Chair. And I'd like to follow up on that as well. And I'm not sure if Mr. Morrow is with us or Mr. Kelly, but I'm wondering if the county is doing anything now that we have some flexibility on developing our own county official plan, as far as more flexibility, and as Councillor Murphy said, creating some of those granny suites. And to take that a step further, the government has just announced this rapid housing benefit. I'm wondering, is the county considering maybe a pilot project where we look at a tiny home development somewhere with a centralized hub for medical services that maybe we could test to see how well that would serve our aging population?
Thank you for that, Councillor Brose. I'll pass that on to Mr. Morrow first, and perhaps Mr. Kelly as well, if there's something that he could add.
Thank you, Chair. We do actually, in the new draft county OP, have a provision for tiny homes. And we had this opportunity to speak with Ken and Scott last week about this. So we will be examining that in the county OP, but I'll turn it over to Craig for more on that. Thank you.
Thanks, Paul. Through you, Chair. No, absolutely. I think the what we just reviewed as the official plan amendment 31, we reviewed at the DMP committee earlier this week. You'll note, and I'm just trying to find the page and I can't at this short notice, the encouragement of new housing styles or a housing mix that would be appropriate to the municipality. So I will note that granny suites by right of law are allowed in all communities, and it just would require an update to your own official zoning bylaws. Of recent, I think it was Laurentian Valley has updated and includes granny suites. I know Madawaska Valley has granny suites. There's several have them, and part of your zoning bylaw update, Mayor Murphy, Councillor Murphy, would be an update to include those as we move forward through the OPA 31. So again, as Paul mentioned, we have encouraged this. To Councillor Brose's direct question about a tiny home health village, I would say to any developer who wants to do this, bring it on. I've heard of a few happening and being contemplated in some of our own municipalities. There's a bit of a disconnect on dwelling size. If you note, a lot of zoning that we have minimum floor areas that a dwelling must have, somewhere in the 55 square meters. The quick math, that's about, I forget the quick math on that. It's still much bigger than some people want. They still want something a little smaller than that. So working around the square footage and working with the tiny home movement, we've seen some success in Lanark or Frontenac County with the new tiny home village that are happening down there. So I think what we're hearing and what you should be hearing is that the county, through your municipality and your zoning bylaws, is that we're open to those concepts. We just haven't seen them being brought forward in full, in full. There hasn't been a real good proposal yet brought forward. So we're just waiting for that to happen. Thank you, Chair.
Thank you very much for that answer, Craig and Paul. Any further questions, committee? Warden Robinson, please.
Thank you very much, Chair. And I have thoroughly enjoyed the presentation so far and look forward to the final document. Just one question, Ken, if I might. So I think I have this written correctly, that 90% of the seniors in the county are living independently. I'm wondering, however, if there is a way of you assessing, are their needs being met if they're living independently? Because it's one thing to be independent in your home. It's another thing to not have the support that you need to have a quality of life.
Yes, through the chair, it's an excellent question. And I think part of our challenge is having the data to be able to give you a really good answer on I think what we've been able to do is sort of triangulate from some of the data that we've seen what might be there. So we know from the census data the number of private households, or people living in private households. And if we subtract that from the population as a whole, that kind of gives us a sense of who's in private households and who isn't. So that's where the 92% figure comes from. Of those living in private, we would then, I think, shift over to, there's not a uniform measure. There is a StatsCan measure of whether you need assistance with more than one activity of daily living, that ADL. But that's a pretty broad spectrum that catches a lot of people. So what we've done here is if we look at the referrals for home care and people actively seeking supports who've been referred, we know that that number's sort of in around the 3,000 range. And of those 3,000, we know that about 37% or thereabouts would be considered higher need or chronic. So the corollary of that is about the other 2/3 do not have a higher chronic need, but have some need for some of those services. So again, I think that the data is a little inadequate to really get at the question you're asking, but I think we can sort of infer from some of that what those needs are.
Follow-up, Warden Robinson.
Thank you very much. And yes, I know the data has definitely been a challenge for you. I'm just also wondering then, how successful were you in actually speaking to the seniors in the County of Renfrew?
Okay, well, thank you for that question. I think because of the challenges that we had in terms of COVID, the stakeholder engagement part of our work was pretty limited. In terms of the stakeholders we spoke to, though, we did speak to people that represented those different agencies. So things like Red Cross, some of the retirement homes, the community care centers, some of those areas. So in effect, we use them as a proxy for providing some of the perspectives of seniors. In the case of some of the community roundtable, we did have representatives from seniors groups, and I can think of one offhand in Arnprior, for instance. And then through the community mailbox, we had a few people who provided specific comments. So I think unfortunately, because of the summer holidays and COVID, it wasn't the full spectrum of feedback that we had hoped for, but we did have representatives from those groups reply.
Thank you. Warden Robinson.
Thank you for the leeway, Chair. So that does concern me, because certainly when you start getting involved in any kind of community service or social service, you know, you can ask me what I think, but it's a person who needs a service or requires some support. That's the information that is critical. Now, I do know Councillor Bennett is involved with the seniors group, and I'm just wondering, were you given a list, or if not, do you want a list of senior organizations that are run by seniors for seniors to see if you can get that feedback? Because, you know, we're all well-intentioned, but I really would hesitate making plans and moving forward with projects when we haven't heard from the people that we're trying to assist.
So through the chair, I think one of the things that we didn't talk too much about in the consultation was the number of people we actually invited to engage in this, which was infinitely more than those who chose to participate. So we did have a very robust stakeholder list that we worked on with staff, covering a full gamut of active living centers, those folks providing care homes, retirement homes, seniors agencies, senior support service agencies. So we really did feel like we covered the waterfront in terms of inviting those people to engage. I think we were a little bit disappointed in the level of participation. So.
Thank you. Councillor Brose, please.
Yes, thank you, Chair. And one thing that came to mind, and maybe it is on the Health Committee's radar, the shortage of physicians is always a major concern for Renfrew County. And is there any possibility that we explore recruiting more nurse practitioners, or is that all part of the recruitment program for physicians?
It appears perhaps Warden Robinson, you wish to respond to that.
I may be able to assist. So certainly if you look at any of the family health teams or family health clinics throughout the county, there's proposals being put in almost weekly from those different centers to the province of Ontario, identifying the fact that we do not have enough family physicians and looking for funding for nurse practitioner run clinics. So that's an opportunity, but again, it comes down to a provincial funding to make that happen.
Councillor Murphy, please. That Councillor Bennett following.
Thank you, Mr. Chair. Through you to Ken, Ken, you gave us a stat early in your presentation that housing, if you're above 30% of your household income, you're sort of upside down. Does that 30%, just out of curiosity, is that your total property taxes, heating, hydro, or is that simply your rent or mortgage?
So through the chair, it's unfortunately, it's an excellent question that people ask about that all the time, because usually it's self-reported in the census question in terms of gross income versus what they would call shelter costs. Now, when it comes to rent, usually that's pretty cut and dried. It's what you pay in terms of rent. When it comes to homeowners, it's less so. So typically, when we talk about those affordability measures in other arenas, it would include mortgage payments, but it typically would not necessarily include those other utility costs. That's the typical way it would be measured.
Thank you. Councillor Bennett.
Thank you. Through you, Chair. I'd just like to talk for a second about the community support services that were challenged to get information from. The three that I actually have heavy involvement with had a very hard time this summer with staff, because we had to close most of our facilities. The staff went home to work. And is there an opportunity to reach out to them again now that we've pretty well got everything settled and people back to work, that can actually put input into this now? Because I'm sure I'm not the only one sitting here with 7 staff members that weren't involved very heavily with the agency over the last 6 months, and we are gearing back up. But that had to be a very big challenge for everybody this year, because as everybody knows, most of our agencies some are volunteer positions, but everybody was off very on ease this summer with coming into a facility and really getting the stuff done we needed to get done. So I'm just wondering if there's an opportunity to reach out to them again to see if that is the case. Thank you.
Thank you very much, Councillor Bennett. Very astute observation, and one, of course, that Warden Robinson had raised as well, is that I think we need to proceed cautiously, as everyone here probably will recall. Certainly, in my opinion, the genesis of this entire project was the fact that the province of Ontario had recognized the substantial wave that was coming of seniors. Likewise has allocated substantial funding towards increasing capacity, increasing the resident spaces, beds in long-term care. But before the county of Renfrew moved forward in perhaps a lurching phase, when often a lot of these issues have been addressed on a piecemeal basis rather than a comprehensive whole, that was the instigation for this, is that a long-term care bricks and mortar is not necessarily the solution to all of the needs coming forward. So given that, and given how vital it is to understand what is the perceived needs of the senior community now, and I would suggest that those probably change with each generation. I expect the iPad generation, when they become seniors, are going to have needs that will be substantially different from those that I will have. So it seems to me that there's a pretty significant gap in the data, in our knowledge, that I'm wondering if there was an opportunity could be provided for extending that invitation again. Mr. Kelly, you have your hand up.
I do. I'm just trying to get Paul's and Shelley's attention, but that's okay. I'm part of the crew that we've been working with Scott and Ken on this. What I would offer, and I think it's fair, Shelley, Paul, I'm looking to you for maybe not a heads, is that when it's drafted, again, this is an update from Ken and Scott, that the draft report will be available online, and we have reached out to the public through a press release and otherwise, that the draft could be uploaded at a future time for further comments, just like we would with any draft report. And then the seniors groups or otherwise could comment on the draft. Often it's easier to edit than it is to create. So now that we've created it, or that at least Refact has created it, then they could offer their opinions and input at that point. But maybe Shelley and Paul, I don't know if you want to, again, say, Craig, you're crazy, or if you want to offer support to that initiative.
I will open that. I will certainly attest in complete agreement, Mr. Kelly. The muse to create only visits sporadically, yet the urge to edit is there at all times. Ms. Sheedy, please.
Just wanted to say that I think that's a great idea.
All right, thank you. That seems reasonable, Councillor Bennett. Warden Robinson, would that be to allay the concerns that you would have? The thumbs up certainly from Councillor Bennett.
Sure, it's a start, absolutely.
All right, thank you. With that, any further questions, comment, discussion? Well, thank you once again, Ken and Scott, for all of the efforts that you have put into this. As I've acknowledged, the impetus for this was to have a well-considered approach to meet the needs of the senior community, not just those in need of long-term care. It was very gratifying that you had acknowledged certainly the recent announcement on funding for delivery of long-term care out into the community through the Renfrew County Paramedic Service. I think it was a big step in acknowledging those needs. What I would say again, in going back to my earlier comments about the piecemeal approach that seems to be there, going right back, certainly the first my involvement is the aging at home strategy, which seems to have been mostly a strategy with very little substance behind it. That in fact, unknowingly, that was what was driving a great deal of the initiative that became community paramedicine here in the county of Renfrew, that was addressing some of those needs. That was extended into various home monitoring. It was also extended into the palliative aspect of recognizing this, of recognizing the distance in our communities. It is also has reduced the reliance on the imperfect health providers. Often that's the emergency departments, et cetera. I know that Chief Nolan is a part of this meeting now, can certainly attest to the overall impact of the community paramedicine, certainly within the Health Links program, again, one of those piecemeal initiatives. That has substantially changed the impact on the acute care system. But of course, all of this is going to require, as you've identified here, and I think it is an outstanding summation of a great number of or a comprehensive list even of the challenges and the impediments that exist. It seems by times it's a Gordian knot, but it is not. However, perhaps a more precise analogy, it is the Tower of Babel that needs to have all of the parties and partners speaking the same language, and I think that that's been missing by and large in coming up with a comprehensive solution. I am very glad, absolutely, on Councillor Brose's bringing forward the planning and the tiny homes potential for a hub, because, of course, I think that the low-hanging fruit is to get some things out of the way that are well within our power to do so. And as Mr. Kelly identified, even the zoning bylaws would be a very good start on providing some address on this. But in any event, what is in front of us now, I think, is an outstanding first step that in the final summation of this will provide a great deal of conversation on improving when it is circulated to the various seniors services and communities throughout Renfrew County. So once more, on behalf of the County of Renfrew, thank you very much for an outstanding document. The other thing I guess that I should say is with each one of these, is the PowerPoint presentation going to be made available to the county?
I believe the committee chair has it, or the your support person has that, so certainly that's
all right. Thank you once again.
Thank you very much.
Thank you.
Councillor Murphy.
No, I was just waving goodbye. Not to you, to our consultants. I mean, this is the new thing, right? That's what we do now.
Thank you very much. With that, then, we are going to pick up the Emergency Services Department report. I'd invite Chief Nolan, if you could take us through that, please.
Thank you, Mr. Chair. It's my pleasure to be here today with committee and present today's report, beginning with item number 1 through you, Mr. Chair, related to community paramedics for long-term care. And I'm sure most, if not all, on committee are aware that Minister Fullerton came to Renfrew County to do the launch on behalf of the Government of Ontario as it pertains to community paramedics supporting people either eligible for the wait list in long-term care or on the wait list in long-term care. And we were one of 5 municipal paramedic services in Ontario chosen for the start, the launch of this program. And in doing that, we've had confirmation that we'll be receiving $1 million for 5 months of program delivery. Our intention is to be up and running by the end of November once the appropriate documentation has been received from the ministry. And that for fiscal 21-22, we'll be receiving an additional $2 million per year for 3 years subsequent in the delivery of what they're terming a pilot program. And I think that's just a convenient way of not making a long-term funding commitment yet. There's no doubt that this program and its elements will be able to better support people that are on the wait list or eligible for long-term care, which I think in turn will also allow for more appropriate placement within long-term care and make sure that the people who truly are in crisis and do not have the necessary supports at home will be able to move more quickly into the expert hands of Shelley and her peers in long-term care. So with that, I think it's certainly, from my perspective, a moment of pride for the county. It's something that, based upon the direction of Health Committee years ago, we were to pursue. So myself, Shelley, Karen Simpson from the Empire Family Health Team, Dr. Sinha, and others have been supporting now for many years. And I think it's also important to note that the proposal that we submitted to the Ministry of Long-Term Care for this model predates COVID itself. It goes back to the end of last summer and into the fall to be able to move on really what will represent a new model of care for community paramedicine. As well, with that, we'll be working more closely with the LHINs and their care coordinators to be able to hopefully better identify, screen, and advance the needs of those who are living on the wait list at home. And I don't think anybody needs a reminder in terms of where the pressures are in the system, namely capacity within long-term care, lack of staffing from a home and community care perspective, and I think as well ALC or alternate level of care continues to remain a pressure point within the system. So there are 4 guiding principles, certainly accessibility, responsiveness, proactive from a systems perspective, and then of course safe in terms of diagnostic procedures. We are working with a number of vendors right now in relation to remote patient monitoring, which I think will become a cornerstone of this program. And we will continue to seek opportunities to be able to reach out to these populations without necessarily having to be in their living room every time. So there are some solutions out there that include video monitoring as well as the typical clinical data points, and then looking at the back-end systems around artificial intelligence and being able to identify problems before they begin beyond the standard alerting that we've used in the past. So I think it's important that I also note, and the chair had asked me some great questions about what will this pay for and what will it not, based upon the tenets of AMO and the Ontario Association of Paramedic Chiefs. It's 100% voluntary to participate. It is 100% funded by the province. So this year's budget workup that I'll be working with Mr. Foss and team next week will comprehend, or I guess consider what it looks like to be able to depreciate a cost over 3 years, for example, instead of 5 from a vehicle perspective or any other purchases. But that's part of the reason that we're receiving $1 million for less than half a year and $2 million a year going forward, so that we can get ahead of some of the costs of startup and do that within the funding envelope between now and the province's year end being March 31st. So we'll need to work that out in terms of what it means for our fiscal year end based on the calendar versus the province's year end at the end of our first quarter. So always a complicated exercise, but we will do our very best to be able to address those issues both in the budget process, but also in the approvals process moving forward. This will mean additional staff. And in the report, it talks about 12 staff in administrative support. So I am working with the CAO's office around the business cases and all of the elements on this one. This significantly allows us to up our game in terms of being able to adequately resource and support a population that has arguably the greatest need. And I appreciate the segue of the previous presenter when he identified that up to 30% of people on the wait list for long-term care should and could adequately be better managed in their own homes. And I couldn't agree more. The missing ingredient, of course, is the funding and the capacity building to be able to do that. And I think that this announcement will allow us to get well down the field in that regard. Item number 2, Mr. Chair, related to COVID update. There's a letter attached from Eric Hanna and to Mr. DeCenza related to our ability to provide swabbing, as well the funding formula issue. So big thanks to the chair, to the warden, and all of County Council, as well Minister Yakubuski for his support in being able to provide us some reassurance around accessible swabbing in smaller rural communities where the $38 a swab just would not cover costs. And then secondly, I'm also pleased to say that we've caught up to the end of August, and Mr. Foss can correct me on that, in terms of our receivables related to our COVID expenses. So at one time, you remember there was quite a bit of angst as to whether we would be getting paid or not. So now we just need to close the gap between August and the end of September, meaning October 1st. And from October 1st, these letters address the funding formula going forward. So I am continue to be confident in Mr. DeCenza and in the health system to be able to reimburse our costs for the work that paramedics are doing. And that continues to be an ebb and flow based upon the incidents and outbreak management within our community. So we are continuing to post schedules on a week-by-week basis. And it's important to remember that we're also doing home-based assessments and testing. We're also doing congregate care assessments and testing. We're doing workplace assessments and testing. and then specific outbreaks for large populations of individuals through contact tracing. So there's a lot going on behind the curtain, but suffice to say that it's being covered at 100% reimbursement, and I'm very proud of the paramedics and my management team for continuing to ebb and flow with the tide that is COVID and be able to stand up and meet the needs of the community, albeit providing irregular testing, but that's based upon last week's experience leading us into the next week. So you'll see increased activity in some communities based upon outbreaks, decreased in others, but we're trying to make sure that everybody has something reasonably close, reasonably timely to be able to meet their needs given the geographic challenges we have in Renfrew. Item number 3, Mr. Chair, related to gratitude. There's quite an endearing letter that we've attached as ES4 within today's package. And as well, you'll see the media relations launch. So big thanks to Carolyn McGrath and Mike Barber for their assistance in getting the word out on all of the efforts that are going on across the system. I understand there's also an addendum related to financial update. So Mr. Chair, I'm happy to conclude my report there. And if there are any further questions, or I'll look to you for timing on any questions related to the financial matters. Thank you.
All right, thank you, Chief Nolan. With that then, committee, we will return to, bear with me, item 1, the community paramedics for long-term care. Councillor Murphy, please, then Councillor Love.
Thank you, Mr. Chair. And although Fairfields is not a long-term care facility in name, I think that your paramedics evacuating 36 people at Fairfields on Tuesday was certainly a welcome addition for us in Bonnechere Valley to know that you guys were there, you're trained, you're able to evacuate effectively. I thought it was sort of ironic in an awful way, but we really thank you and all of your team, Mike, for making this the best it could be. And I think it made those seniors feel that they were really being taken care of, that it wasn't just our staff or the fire department or the board of Fairfields. So just a shout out to you and your team. Thank you.
Thank you, Mr. Chair.
You please respond, Chief.
Thank you. So I think while it may not be apparent how that connects to this in item number 1, but I will connect those dots for you because over the half of the staff that were on site at Fairfields were community paramedics who first responded and put off their daily activities of point of care testing, swabbing, assessment, managing people in their own homes to be able to lean into a crisis such as it was. And it was the community paramedics that worked very closely with the paramedics to set up the reception center before anybody even showed up at the Legion. So, this is a very good example of where we have a warm handoff. And in item number 1 specifically, these are all capacity building opportunities that provide us 100% funding to build the surge capacity into the system, to be able to flex, be nimble, and meet the needs on a day-to-day basis. If there's a cardiac arrest in the community, as we've had today, the community paramedics are leading in with the other 911 paramedics. So, and at the same time, whenever possible, they'll cancel the ambulance so that those paramedics can be available for the next 911 call. And they work very collaboratively also by referring patients to the community paramedics for people who are living with unmet needs. So what's going to be very interesting is by working through this Ministry of Long-Term Care initiative is we can kind of pull back the curtain on who is and is not on the wait list for long-term care that we're already supporting in the community, and then also use it as a surveillance tool to identify other eligible people that we just don't know about today. So thank you for the shout out, and all the credit goes to the staff on the front line, your staff, Mayor Murphy, as well as those at Fairfields. I think it was an exceptional effort and demonstrated that by working together, we can be very synergistic in our approach.
Thank you for connecting the dots.
Thank you, Chief. Thank you, Councillor Murphy. Councillor Love, please.
Thank you, Chair. We are currently on the Roma board working on our breakout sessions for the upcoming virtual conference. One of the ones that is on the books to flesh out is community paramedicine. Obviously, it's phenomenal news that our staff is engaged on the cutting edge of this new program, and I'm not sure how to ask this, but I guess I'm going to ask: is there, do I need to ask committee? Do I need to ask county council? Do I need to ask Mr. Morrow? Would Chief Nolan be willing to potentially help Roma to flesh out and possibly work with us on that presentation for our conference? Because this is, we are here, we're engaged in this activity that is going to really change the face of how we look after our seniors. So I'd really like to ensure that at the very least, if possible, Renfrew County was a part of that breakout session. And as everyone may not be totally aware, tomorrow at our board meeting, Renfrew County VTAC is doing a presentation. And I am hopeful that the board will see the merits of what's happening in Renfrew County with VTAC, and potentially that will also be engaged in and hopefully brought into as a part of that presentation. So I'm putting it out there. I can't speak for anyone, but I'm wondering, is there an interest? And if so, could we connect the dots between our great staff and what's going on and the Roma board and get this out in front of all our rural municipalities? Thank you.
Thank you for that, Councillor Love. I'll take a stab at this first. This is the last meeting of this year, so what's the harm? I've got nothing to lose. On this, I would suggest that perhaps on working with, at this point, maybe it would be appropriate to have direction to staff. If there was an expectation of participating perhaps in the breakout, I think in my estimation, the appropriate means by that would be probably through an invitation from Roma to participate in that session. But having said to those things, certainly at the peril of the warden, under whose pleasure I serve, I will defer to her. I saw Warden Robinson, you had your hand up, and also Mr. Morrow did as well.
I like that you're taking advantage of the last committee meeting of the year to spread your wings, I would say. Anyway, so tomorrow, yes, Dr. Fitzsimmons, myself, Simon, sorry, and Chief Nolan and I will make the presentation at Roma. Councillor Love, I was really hoping that at the end of that presentation, we would get just that type of invitation to join the Roma conference. So hopefully that all comes to fruition tomorrow.
Thank you, Warden Robinson. Mr. Morrow, have you anything to add to that?
Sure, I was, thank you, Chair, and through you to committee. I was more going down the road of other duties as assigned for Chief Nolan. Mike is also, I believe, the vice chair of the Paramedics Association as well, and could very well do it under the guise of that role he plays, in terms of representing his fellow chiefs and other paramedics. So I'll leave that to the chair and the warden and Chief Nolan.
Thank you, Mr. Morrow. Just on future, if you could lean a little closer to the microphone, if you wouldn't mind. Councillor Love, please.
Thank you, Chair. I just didn't want to be in the meeting volunteering Chief Nolan without, him at least having a heads up and an opportunity to decide whether he has the time, because he's obviously very busy, but also without, I'm not sure what the protocol is. I didn't want to volunteer him to assist Roma without committee and the senior leadership understanding and knowing and agreeing, and also if Chief Nolan is willing. So I'm willing to push for it in the meeting. I just need to know that everyone's comfortable with that if I'm volunteering him. And I think I'd want to hear from Chief Nolan. Thank you.
Perhaps, Chief, if you could identify if you have the bandwidth per se to perhaps give some assistance.
So thank you. Thanks for the question and the very gracious opportunity to contemplate the answer. of course, I'll be happy to support it. I think this is a great strategic opportunity to not only get involved and share the good news that is community paramedicine, that is the VTAC model, that is our palliative care program. And I think we need to be comprehensive in that by design. So as we've seen at AMO conferences in the past, sometimes things can go a little sideways if you don't get the right panel together. So wherever I can do to help not only speak to issues, but also help in the lineup so that people do get a full breadth understanding of the issues and the opportunities that are at hand. So I'll be happy to do that. And I'm sure Amber, who's not on today's call, will be happy to hear that I volunteered her as well.
Thank you, Chief Nolan. Councillor Love, please.
Thank you. I will unabashedly volunteer then that we would that Chief Nolan will offer them any assistance that is needed to pull together that session. And thank you very much. I really do appreciate it. I feel confident now doing that.
Thank you. I will bring to everyone's attention, of course, we are in an environment where it seems uncertain what powers lame duck have, at least south of the 49th parallel. It has become quite obvious. So we're divining what the route is. I would suspect, though, Mr. Morrow, that Chief Nolan will certainly be participating, I'm quite certain, in the VTAC presentation tomorrow. It seems to me it would still be appropriate that staff be directed to engage with Roma towards the Roma conference in January at this point, and pending a formal invitation to participate in a breakout session to follow.
Thank you, Chair. I agree. That sounds like the motion right there, if that's okay with you. That this committee directs Chief Nolan to participate if requested in the organization of the Roma conference with respect to the topic of community paramedics.
All right, thank you. Do I need a resolution to that effect, Mr. Morrow?
It's direction to staff, so there should be a mover and a seconder.
All right, thank you. Can I have a mover then, please? Councillor Murphy has so moved. Councillor Love has seconded. Just before I call the vote, I do also wish to acknowledge and thank you, Chief Nolan. It is, I think, will continue to be vitally important as we move forward to be cognizant of the concerns from the municipal sector and through AMO that paramedics do not assume healthcare costs of our own. It is, you had acknowledged at the outset, that the participation in this program right now is voluntary, that it is 100% funded by the province. And I think that those are critical components in continuing to move forward, that there is comfort amongst the municipal sector that the anticipation is not to assume healthcare costs from the larger health system. With that then, all in favor? That is carried. Thank you. Moving on to item number 2, the COVID-19 update. I just want to acknowledge all of the efforts of staff working with Ontario Health and Ontario Health East in getting the funds flowing. On top of which, I also want to acknowledge the significant efforts of staff, but also the warden in ensuring that we continue to have accessibility to the assessment centers across our broad geographic footprint here in Renfrew County. It is, in my estimation, unremittingly, we will continue to advocate on behalf of the health equity, that our community deserves everything that any community in the province of Ontario has. So I have to give great kudos to all those that leaned way in to ensure that we were able to continue the mobile access centers across the county of Renfrew. So thank you to everyone for that. Sorry, Chief Nolan.
Mr. Chair, I think I'd be remiss in not saying that Ontario Health East, Mr. DeCenza, and his team with Daryl Tooley have been exceptionally honest brokers and good partners for us through this process. And I think it's also important that, as I'm sure the warden would echo, Minister Yakubuski's support and interventions, just advocating on our behalf, have been instrumental in moving the ministry forward with funding letters and alternate funding mechanisms. And I think that that is critically important because I'm not sure people truly understand the difference between the Government of Ontario and the Ministry of Health versus Ontario Health, which is an entirely separate organization that has to receive direction, especially where funding is concerned, from the province to be able to move forward. And I had a sense that Ontario Health was feeling a little caught in the crossfire on this issue. But I just want to assure committee and the public that everybody was working in the public's best interest to ensure a high level and a high availability of care through this process. And I just want to thank Mr. Gicenza and Daryl Tooley for their help in advocating, because they kind of became the meat in the sandwich on this one. And I think in fairness, they were working just as hard as we were to be able to move this file forward.
Thank you very much for the elaboration on that, Chief Nolan. Absolutely commendation to all of those that recognize the challenge in the rural and remote populations in Ontario, and in particular here in Renfrew County. So thank you for providing that clarity. Item 3, gratitude. And finally, then, the Treasurer's report, the addendum, item number 4. Any question or comment? I will just once again, I'll raise it only once. It did come up this morning in Finance and Administration. We are certainly seeing here the paramedic service report. We will also, in Ms. Sheedy's presentation, we will be seeing the Treasurer's report for the 2 long-term care homes. Across the entire enterprise, COVID has had a significant impact. I think that there's scarcely a heading within the larger Treasurer's report for the whole of the entity of the County of Renfrew that there is not a COVID line item. On top of that, there's been some substantial funding initiatives that have gone a great deal of the way towards alleviating some of the pressures within ours, as acknowledged certainly with the monies flowing from the VTAC. The range on those, I think it was something on 1.2 million has been the monies that are flowing or anticipated to flow from VTAC. And I think on forestry, the COVID expense line was $21. So I think that pretty much encapsulates the entire spectrum of where the COVID has impacted. But I think from the larger perspective, it is difficult, or certainly it was difficult for me to be able to come to real grips or grasp how we have been progressing on the finance, the budget of the County of Renfrew, given the enormity of the impact of COVID. So just from a general perspective, that would be my comment. With that, one more opportunity. Any further comment on the Treasurer's report for the paramedic service? I see none. Can I have a motion to accept the report of the emergency services, please? Councillor Bennett, seconded by Councillor Love. All in favor? That is carried. Thank you very much. With that, I will ask, we are now an hour and a half into this. Does anyone need a short break? A respite, if you will. All right, it is on my clock, it is saying 2:28. If we can convene in 10 minutes sharp, please, it would be most appreciated. Welcome back, everyone. We will pick up precisely where we left off. Ms. Sheedy, if you could take us through the long-term care report, please.
Thank you, Mr. Chair. I would be happy to. And again, good afternoon, members of Health Committee. Before we get started, I would like to introduce Kim Saunders, who's the new Director of Nursing, Director of Care for Bonnechere Manor. I know I had provided some background information for you on Kim shortly after we recruited her. But just as a reminder, she did start with us in mid-October, but she hasn't been with us quite a month yet. But she does come to us with a solid clinical background and of most value, previous experience as both an acting director of care and an acting administrator. And to start in a home as large as Bonnechere Manor in the middle of a worldwide pandemic is something. And to say that she hit the ground running is an understatement. So with that, Kim, welcome. And as committee will recall, it is my normal practice as part of the orientation to the governance process in a municipal home that new managers have the experience of a health committee meeting followed by a county council session so that they see that flow. Thank you.
Thanks, Shelley, and I'm really excited to be here. So thank you all for allowing me to be present today and observe your council meeting.
You're most welcome here, Kim. Very glad to have you joining us this afternoon and look forward to meeting one day in person.
Welcome. Thank you.
Thank you, Mr. Chair. Moving on to the report, which starts on page 14 of your package. Item number 1 is the Bonnechere Manor resident statistics as of the end of October 31st, 2020. Bonnechere Manor resident statistics unfortunately contained a few typos that of course our chair picked up on. And so if you just bear with me, I'll read them out to you and know that they will be corrected for the county council report, the minutes and for the county council report. So the stats as of the end of October 31st were actually correct. It's the previous ones that were incorrect. So August 31st, I'll just run through the column. The population at the end of the month was 157. The number of female residents was 109. The number of male residents was 48, and the number of vacant beds was 9. Bringing us to a year-to-date occupancy rate of 96.98%. Remember that asterisk because I do want to make a comment about that. Unfortunately, we had 1 resident death, no discharges, and 3 resident admissions. Similarly, for September the 30th, we had 155 residents made up of 108 female, 47 male, with 11 vacant beds at the end of September. Occupancy rate of 96.82% at that time. Deaths were 4, resident discharges were 0, and resident admissions were 2. I just want to make a note, and it actually is in the
Shelley, your mic went mute.
Shelley just muted herself.
too. Sorry about that. So just noting the note on the top of page 15 that of course our respite program is on hold at this point. But those asterisks that I mentioned earlier, it's just relevant when we come to the treasurer's report. You will see in red there is a statement regarding occupancy and the exception. So let me tell you the rule first. The rule is that homes have to maintain a 97% overall occupancy level for the year in order to be entitled to 100% of the ministry funding. And we never have any issue doing that with our wait list. The only reason we're not 100% is the time that it takes for one resident to leave and a new resident to come in. However, this year, 2020, the government suspended that requirement. So there is no financial penalty if you don't maintain the 97% occupancy. And I'll remind you of that again when we get to the treasurer's report and you see that statement. Moving on to number 3 is the wait list across the 9 long-term care homes in Renfrew County as of the end of September. Item number 4 is an update on COVID. The first bullet point is my goal to give you an up-to-date as of this morning status report. So I'm happy to advise you in terms of residents, we have no residents in either homes exhibiting any symptoms. We are waiting for one swab at Miramichi Lodge related to a new admission. In terms of staff, as you know, we are testing our staff every 2 weeks. So at any given time, we have a large number with about 250 staff in each home. We have a large number of swabs that we're waiting on those results to come back on. So for example, this morning, there were 58 at Bonashire Manor and 107 at Miramichi Lodge. Just depends where they are in relation to that surveillance cycle. But over and above that, Miramichi Lodge has one symptomatic staff at this point, and Bonashire Manor has 2. Obviously, those staff are self-isolating at home. Moving on to the other bullet points on page 15 is what's called a class order from Dr. Cushman. It's appendix number 1, found on page 22 of your package. Of course, it's applicable to anyone that lives in Renfrew County, and I'm sure you are aware of it, but I just wanted to include it in this package, and we definitely let all of our staff know as well. Following along is just an update with respect to the COVID Commission. They did provide what they're calling a first interim letter, and the link to that is in your package. And the rationale, as I have inserted into your package on page 16, is that given the high risks in long-term care, the Commission is making some early recommendations that focus on staffing, collaborative relationships, and IPAC. The report goes on to outline what those key focus areas are. I won't go through them, but just draw your attention to the things that we've been talking about and with your support have actually actioned. And those are things like more full-time positions. Of course, we know the government has recently announced the average of 4 hours of direct care per resident per day. And we have long discussed both in this forum and at our weekly EOC meetings, the delayed turnaround time for the COVID test for both residents and staff, and of course the public as well. Just a reminder to committee that the final report is due to the government by April 30th, 2021. Moving on to the next bullet point is an update with regard to the Ombudsman and also related to COVID and long-term care. At this point, they have made 4 recommendations. There are no directives, but I wanted Health Committee to know that we did look at them and give consideration to whether we would either already meet them or if there was anything more that we could be doing from a best practice approach. So with respect to number 1, you're well aware that we do have an emergency plan and we do have a contingency plan, and both of those, 4 of them, both of them for each home, were dusted off early in the pandemic, and we have looked at it again periodically throughout the pandemic. The specific recommendation is in having a partner organization. Of course, we have each other as sister homes. And there's lots of consultation and communication, I would say enhanced, happening amongst all 9 long-term care homes in Renfrew County right now. But in terms of a hospital partner, we knew unofficially that RVH had reached out to Bonashire Manor early on in the pandemic, and similarly PRH with respect to Miramichi Lodge. However, I did make a reach out to both of those organizations just to confirm that that would be their understanding as well, that we did have that kind of relationship, and both hospitals were very quick to confirm that. The second one regarding visitor changes, the recommendations are exactly in line with our medical officer of health had directed early in October 15th, actually. Sorry, he directed October 8th. The province followed suit on October 15th. In terms of communication resources, again, we have the value of the position of Mike Barber, and over and above that, our communication with our key stakeholders, being residents, family, and staff, has never been greater. I would say on average, I communicate directly with those stakeholders once a week because there's just so many changes and a need to do that. And the last one is enhanced whistleblower protection. And this committee may be aware that we have had a long-standing policy in both of our homes in making sure that our staff know that they are protected if they need to report something. So whether it's related to resident care or IPAC protocols or anything related to the operations of the homes. And that has been in place for many years. New staff are oriented to it, and every staff must review it annually along with many other policies and procedures we need to review annually. And then the last bullet point that I have specifically under COVID is just related to IPAC audits. So you may recall that our health unit has completed 2 on-site audits since COVID began. No concerns at either home. However, from a best practice standpoint, I have asked a manager in each home to take the same audit tool and do it themselves and submit it to me once a week. So we have this rotating amongst all the managers so that there's a fresh set of eyes once a week to make sure we're not, as Dr. Cushman would say, letting our guard down, not falling into any kind of sloppy practices or anything like that. So that's happening on an ongoing basis. And I did provide the actual audit tool to you just so you had a sense of the kinds of things the managers are looking at, and that's found on page 26 of your package. Item number 5 is the long-term care staffing study. Committee will recall that as part of Justice Gilley's public inquiry was a recommendation that the ministry undertake a staffing study. They did agree to do that and in fact launched it in February of 2020, obviously pre-COVID. We did get that report over the summer, and the link to it is found within your package. And what you'll see in that report is, again, that reiteration of the need to mandate and fund the minimum 4 hours, average of 4 hours of resident care per day. And so we were very pleased on November 2nd when the government announced, and that's Appendix 3, page 50 of your report, that they are in fact going to go ahead with increasing the direct care for residents to an average of 4 hours per day. They have indicated that this goal will be met by 24-25. And while there were no specific details in the budget announcements last week, the government did indicate in this release that more information would be coming in December. So we remain hopeful there will be some movement towards this goal in the year 2021. I do, Mr. Chair, really want to take the opportunity to thank yourself and the warden and previous chairs and wardens because, of course, this ask has been, well, first of all, it's been a recommendation since 2008, so more than 10 years, 12 years now. And it's been the focus of any of the advocacy that we've been able to do, whether it's through AMO, through Advantage Ontario, et cetera. So thank you for your diligence on that, and nice to see that moving ahead. I also just wanted to point out that an important distinction is that the government has indicated to Advantage Ontario anyways, that the 4 hours will be based on hours worked versus paid hours. And that is something that was always contained in any of the lobbying efforts by the County of Renfrew. Very important because, of course, paid hours include things like sick time and vacation time and do not have any impact on resident care, whereas worked hours are hours at the bedside. And so we're very pleased to see that the benchmark is going to be worked hours. Moving on to item number 6, just I wanted to give you, seeing that this is our last meeting, an update on the butterfly approach, which is of course the model that you saw in place at Malton Village as created by Meaningful Care Matters. Certainly, you know, goes without saying, lots of challenges as a result of COVID, but I'm very, very pleased and proud of the efforts that our management team have been able to lead regardless of those restrictions. The biggest thing that we had to postpone was the training. And not that we couldn't, although our consultants are from the UK, and not that we couldn't have done it virtually. It was more a question of staffing resources, and we just didn't feel that it would be prudent to pull large groups of staff away from resident care in the middle of a pandemic. And so we have paused on that. However, any of the environmental things, enhancements that we could go ahead and do, we are in the process of doing. So for example, you'll remember those vinyl door coverings you saw at Malton Village. The Miramichi Lodge has already completed those on their dementia unit. The Manor is finishing as we speak. And then both homes have a goal before the end of the year. So just as a recap, for the resident room doors, the vinyl door coverings are meant to mimic what your front door would look like. So it's to be more home-like and to help with wayfinding and that kind of thing. In terms of the other doors that are found on a dementia unit, things like medication rooms and staff report rooms and supply rooms and those kinds of things, those are all locked on a secure unit, in fact, probably on most units. And so for residents with dementia, we actually want to camouflage those doors because it creates a source of frustration for them when they see a door handle and they try to access it and they can't. So we're in the process of doing that right now. We'd also like to finish before the end of the year what we're calling a sky view. So picture a blue sky with white fluffy clouds in our tub rooms, so that when our residents are reclined in the tubs, they have something nice to look at besides a white ceiling. We are going to also finish painting our hallways in those bright colors you saw at Malton Village. And we are consulting with our architect right now, as you approve through the RFP process, how we will take one unit at each home and create 2 smaller units out of it, which will include 2 smaller dining rooms. And finally, again, you'll recall at Malton Village where you saw the wall space between each resident's room created what they call vignettes. So if that resident had been a farmer, was interested in gardening, or had been a teacher, or whatever their interests were, the vignette would capture that and give them something visually stimulating to look, touch, and so on. And so we're in the process of giving consideration to what that would look like in each of our homes. Item number 7 is an update on bargaining with respect to CUPE at each of our homes. Committee will recall that in February 2020, we commenced bargaining with the Miramichi Lodge bargaining unit. Unfortunately, those proposals were both cost prohibitive and unreasonable given the current economy and climate. And therefore, the employer took the position that conciliation was seen as the only option to move the talks forward. That happened on May 28th, 2020. And while we had discussed at that time going forward to a second day of conciliation, unfortunately, the next day, the conciliator advised us that the union had requested a no board report, which you know is the next step in terms of moving forward for arbitration. Following this, the employer made another offer to the union, recognizing the unique circumstances of the pandemic, which was basically to maintain the status quo with respect to our collective agreement with a modest wage increase, but unfortunately this was declined. So with respect to Bonnechere Manor, we were originally scheduled March 18th, which was, shortly after the pandemic was declared. So we obviously postponed that. But we did make the same offer to that CUPE local, which again was status quo with our collective agreement language and a modest wage increase, but that was also declined. So we did proceed with negotiations, which happened on July 29th, 2020. And again, the union proposals were both cost prohibitive and unreasonable. We did proceed to conciliation. That happened on October the 30th. However, before we were able to enter into any discussions with the union or the conciliator, the union advised us that they were requesting a no board report, which again means that we're moving to arbitration with that union as well. Item number 8 is the treasurer's report for each of Bonnechere Manor and Miramichi Lodge. The Manor starts on page 53 of your package, and the Lodge starts on page 60 of your package. Perhaps, Mr. Chair, I could just try to address most of the questions that you had posed in the case that committee had those questions as well. And then, as you go through the report, if there are other questions, we will certainly do our best to respond to them. I was hoping Mr. Foss would be on the call, but I don't believe he is with us at this time. So with that, again, I'm looking at page 53 of the Bonnechere Manor Treasurer's Report as of the end of September, and that warning signal in red indicating that the actual days are less than the 97%, and that's what I was referring to earlier. We don't need to worry about it this year. It's an automatic trigger that comes up in our finance system, but again, we've been told by the ministry, don't worry about your occupancy in the year 2020. And I will note that the Advantage Ontario has already asked the government if we will be getting that same consideration for the year 2021. So with respect to the salary line, if I could say this for every department in both homes, the thing that is consistent is that you will see every line being over, and that is a result of the fact that the pandemic pay, of course, was not budgeted for, but has been paid out. However, having said that, the converse is also true, and that is that we did budget for a CUPE and where applicable in the nursing department ONA increase that was budgeted but has not been paid out. So at the end of the year, we will put those into reserves until those collective agreements are settled. You will see in every department there is a COVID line. It includes all and sundry of things that are over and above our regular supply and equipment costs and those kinds of things. First and foremost is PPE, and it's charged to every department depending on the number of staff. But it also includes things like, sorry, just let me go back to my list here. So I mentioned PPE, additional cleaning supplies, things like iPads for our screeners and those kinds of things. The high intensity it appears twice in our treasurer's report here under the nursing department and then also on the revenue side. So there's both what the government calls a non-claims based approach and then the claims based approach. So on the non-claims based approach, well, actually on both of them, we guess we're going through the budget process based on last year's numbers, but of course the residents could be totally different. Their medical circumstances could be totally different. And then as well, the government is always many months behind their refunding us for that. So you will see that those lines don't match. And that is similar with the falls prevention as well. But I would note specifically for Bonnechere Manor that there were some funds, of course, the ministry year ending on March 31st. We had an allotment till then, and then we have a new amount starting with the new ministry year, April 1st. And so it is on Kim's radar to make sure that we spend all of the funds that were effective as of April 1st. There were funds, however, that were unspent as of the end of March 31st at Bonisher Manor. Similarly with the lab fees, this is 100% funded by the province, but always behind on receiving that payment from the province. The RISE subsidy, it's flip-flopped over the years. The ministry used to show up at the end of our, under our revenue side, but the ministry has since rolled it into our nursing and personal care envelope. So you now see it there instead. Raw food, you will see both homes are showing underspent. I have been assured by both of those managers that they are on track to spend all of the funds because of course they would have to be sent back to the government. And again, it is a case of outstanding invoices. The chair did note that we are overspent in our hydro at Bonisher Manor, and that is typical for us. We do see over the fall months that that number will come down, and we are anticipating being close to the budgeted amount. Purchases, services, again, it is typical to see more spending happen in the the third and fourth quarter of the year, and certainly COVID has delayed things more than normal this year. In terms of the COVID revenue, I just wanted to review. So I'm on page 58 of the report for Bonisher Manor. So it is listed as province one-time funding, but it is made up of several different funds that again were unbudgeted, but are related to COVID. And so for the manor, which is $957,665, it is made up of pandemic pay, a little over $610,000. You may recall in the first 2 months, in March and April, the ministry gave each home $75,000, $34,500 for each of the months of March and April. So it didn't matter how many beds you had, didn't matter whether you'd had an outbreak or not. So that includes that $75,000. And then starting in May, going forward to up to and including September, we have had what they're calling prevention and containment COVID funding. And that is based on the number of beds. And also if you've had an outbreak, you're entitled to more funding. And once you've had an outbreak, like for example, when Miramichi Lodge had that staff positive early in March, Miramichi Lodge continues to get additional outbreak funding for each of the subsequent months. So all of those comments that I've made are the similar for Miramichi Lodge, up to and including the one-time funding under revenue. For Miramichi Lodge, it is $932,000, made up a little over $559,000 of pandemic pay. That $75,000 emergency funding for March and April, as I have just mentioned. And then moving forward in May, it's now called prevention and containment funding. We tend to get it annually. They call it one time, so there's no guarantee we'll get it each month, but we have been. And to date, the lodge has received $298,400 again to make up that total amount. Then, Mr. Chair, moving on to item number 5 in my report, which is fundraising on page 20. There's an appendix there, which is page 69 of your report. It contains all of the details regarding, well, it's a media release, but it contains all of the details regarding the virtual coffee house, which is happening on Friday, November the 20th. And if anyone has any questions, please reach out to Lainey at her contact information there. And then last, I have a resolution, which is item number 10. And if I can, I will go ahead and read the recommendation.
Just bear with me one moment, Councillor Murphy.
Yeah, I'm sorry. I meant to email Shelley earlier. Lainey's email is not working.
Oh, okay.
Just
Someone?
so everybody's
Okay,
trying to buy it.
Okay, thank you. I'll follow up on that.
Thanks.
Mr. Chair, would you like me to go ahead and read the resolution?
Please carry on. Yes.
Thank you. Found on the bottom of page 20, signing authority for Bonnechere Manor. The recommendation is that the signing authority for Bonnechere Manor trust accounts be updated to remove Brittany Finley and add Kim Prentice, effective November 16th, 2020. Further, that 2 of the following 4 names have signing authority: Jeffrey Foss, myself, Sandra Block, and Kim Prentice. The background is that our current administrative assistant finance will be away for a 1-year maternity leave commencing December the 4th. And Ms. Kim Prentice has been a successful applicant for this coverage during that time. And finally, for me, Mr. Chair, before I conclude my report, I know I speak on behalf of Chief Nolan, but from the staff, I would like to thank you and the warden and all of Health Committee for your incredible support in the year 2020, seeing that this is our last Health Committee meeting. You know, something we have enjoyed every year, but it goes without saying that this year has been very unique. And when I reflect back on all of the issues and challenges that I have brought to you and your incredible support, whether, you know, it's sending a letter to the Premier and the Minister on Good Friday because we didn't have enough PPE, or phone calls and many emails that happened on Mother's Day because we had positive cases. There's been a lot of time and attention paid to our homes, and I know to emergency services as a result of COVID. And our residents and our staff benefit because of your care and concern. And so on behalf of Chief Nolan and myself, thank you very much. That concludes my report.
Thank you very much, Ms. Sheedy. I certainly, on behalf of the committee, appreciate your comments. What I have found often is perhaps those things that go without saying. They are much appreciated when they are said just the same. So thank you very much for your very kind comments. And here we find ourselves in a surreal year. I don't know that we've invented a word that is good enough for 2020. Surreal is the only one that I seem to have access to right now, but thank you very much for those kind comments. With that, committee, we will return to the agenda item number 1, and I'd invite any question or comment, please. Item number 2, Miramichi Lodge statistics. Item 3, the waitlist information. Item 4, the COVID update. Just on the COVID update, I wanted to bring forward that with respect to the Ombudsman's report, it became apparent to me in reading through this that how in front of the curve we have been here. Certainly Shelley has been with the long-term care homes in Renfrew County have always been out front. It has stood us in good stead as we are unfortunately once again seeing the second wave is wreaking havoc in long-term care. We have taken steps in advance often of the rest of the province, and it has stood us in good stead. I think that certainly within my own operation, my agricultural operation, when some of my staff say, should we needle that calf? I say, well, he's either fine or he's not. If you ask the question, if you need to do something, you need to do that thing. So in all instances, I have to commend Ms. Sheedy for her always being out in front of the curve on this pandemic. And I think it has stood staff and residents of the 2 long-term care homes in very good stead, that their health is always number 1. Thank you. Also, with respect to the, I also wanted to bring forward on the last bullet point here on the checklist. I think that that's an exceptional checklist, and I know a lot of those items that are contained within that are perhaps intuitive, but it is just the same when they are all established in one document. I think it provides a fantastic basis. There are, in fact, 76 different prescriptive measures identified in this report. And I think it's once again is a very valuable document, given that hopefully the pandemic that we're in now is the 1 in 100 year pandemic. And some of those documents that had been gathering dust for some time, at some point will gather dust once again. But just the same, it is outstanding to have these kinds of documents that can provide some guidance to us. With that, item number 5, the provincial long-term care staffing study. Also, there is bear with me, sorry, bringing both forward this study and the comments with respect to the province's commitment now on the 4 hours. And as Ms. Sheedy has identified, one goes back at least to the Sharkey report in 2008 that has identified this challenge, and it is reassuring to me. It seems to me some time ago I read that in the Hibernia oil fields, perhaps Mr. Perkins can attest to this, when the icebergs are advancing, the tugboats don't just go a couple of miles up from them, they go 1,000 miles up and begin inching them away so as to miss them, the oil drilling platforms. Likewise, it seems unfortunate to me that it has taken now 12 years of slowly nudging these things with the tugboats that we are finally getting some traction, though noting, of course, that it does require a great deal of logistics support, hiring and training, etc. But I am nonetheless very gratified on behalf of all of those who have held this seat or Warden Robinson's seat that it is, and of course, Ms. Sheedy, your seat as well, that it is beginning to have traction. Item number 6, the butterfly approach implementation update. Item 7, long-term homes, long-term care homes and QP bargaining. Item 8, the treasurer's report. And thank you, Ms. Sheedy, for a very comprehensive report on the treasurer's report. As I've acknowledged earlier today, COVID has certainly wreaked havoc with the budgets, both on the revenue and expense side. And I am very pleased that in January, Mr. Foss will be bringing forward some more clarity with respect to what the impact has been to the larger enterprise. Item 9, fundraising, and as identified by Councillor Murphy, there is perhaps an issue with the email address. I think perhaps Ms. Gruntz, you wish to address that?
Yes, her first name, Bolt, is spelled wrong. It should be B-O-L-D-T. So it's Lainey Bolt Johnson.
So there is a pesky missing D between the L and C. Thank you. Councillor Murphy.
Thank you, Chair. Through you to Shelley. I'm also intrigued to see what it's like.
I wonder, Councillor Murphy, if you could turn off your video, because I could not hear that. It was frozen. If you could repeat.
I'm just intrigued, Shelley, what a can of wine looks like.
I'm certain that Councillor Murphy is not alone in that inquiry.
Through you, Mr. Chair, to Councillor Murphy, exactly what a can of beer looks like. Yeah.
With less head.
Who knew?
Anything further on fundraising? Okay, can I have a motion on the resolution regarding signing authority, please? Moved by Councillor Murphy, seconded by Councillor Regier. Any question, comment, discussion? All in favor? That is carried. Thank you. Can I likewise have a motion now to accept the long-term care report, please? Councillor Love, seconded by Councillor Lafreniere. Any further question, comment, discussion? All in favor? That too is carried. Thank you. With that, Mr. Morrow, there was no administration report at time of mailing. Is there any to come forward at this point?
No, sir, there's not.
Thank you. We do not have any Board of Health minutes. Is there any new business? I'll go with Councillor Bennett first and then Mr. Morrow.
Thank you, Chair. I just wanted to bring to committee an article that I read the other day through the newspaper, of course. But Stormont, Dundas, and Glengarry have put together a mental health team to work with the OPP out and I'm wondering if that's something that this committee be willing to take on in the new year, sitting down with them, getting the information, how the funding happens, and see if there's any interest whatsoever in following their lead.
Thank you for that, Councillor Bennett. It does sound intriguing. I'm unfamiliar. I wonder perhaps as a first step, if you could forward that news item to Mr. Morrow, and that might be a good starting place.
That would be helpful. Thank you, Chair.
That's okay. Thank you, Mr. Morrow. And Mr. Morrow, you had some new business.
I believe Councillor Doncaster had his hand up as well.
Councillor Doncaster.
Thank you, Mr. Chair. It's a little bit irrelevant for this committee, but I did not have this information earlier for the Finance and Administration, and I wanted to tell somebody. There's enough people here, so, and I will forward this on to Mr. Morrow and Rose. But I did get my appointments for the FCM Board of Directors committees, and I've been appointed to obviously the Ontario Regional Caucus, the Standing Committee on Environmental Issues and Sustainable Development, the Standing Committee on International Relations. By default, I'm a member of the committee as a whole, and the Rural Forum is the last but not least. And further to that, I was elected by the Board of Directors to be the Vice Chair of the Rural Forum, FYI.
That is enormously outstanding news, Councillor Doncaster. I am very pleased that you did bring that forward. On the down low, as I had said earlier, I'm not sure if you were present at the time. Of course, this being the last committee meeting of the year, there's enormous latitude. What's the worst thing that could happen to you for bringing forward something irrelevant? Irrelevant is in the eye of the beholder. I am enormously pleased that you brought that news forward, so thank you. Any further new business? Mr. Morrow, please.
Thank you, Chair. I just wanted to take this opportunity to thank you, Chair, and the other members of the committee. This year has been exceptional, as Shelley has indicated. In fact, until a couple of people had said something to me, I was so caught up in what was going on, I forgot this was the last committee of the year. So it's, you know, the time gets ahead of you, and there are, you know, the things have been moving so quickly that I can't believe we're here already with the last committee, and we'll be getting into a new session of County Council in 2021. So again, thank you, and my apologies for not acknowledging that earlier. Thank you.
I do so much appreciate you bringing that forward, Mr. Morrow. I too wish to recognize that this has been an astonishing year. It started out like any other and has become enormously different. And I have been saying throughout, certainly out here in the agricultural parts of the community, I would liken it to walking in a clay field. When that field is dry, it is like walking on concrete. And when it is wet, for every step forward, you slip back about 30% of that step. And it feels to me that that is what COVID has been. Just doing the normal course of events, it seems that every step forward, we're only getting about 70% of the way there. It is taking that much more effort just to do the normal course of events. So having identified that, I am absolutely gratified that this committee has put in so much effort into this year, into these challenges. It has certainly made being chair a fairly simple prospect for me. The engagement of everyone, the preparation of everyone, the challenge that have been overcome has been simply outstanding. So I wish to commend every one of you for that. Having said that, now, of course, I must acknowledge the indefatigable staff. I recognize that the staff across the enterprise, and certainly I'll extend that, Mayor LeMay, through you to the city of Pembroke and to all communities. It has become that much harder to do these things. But of course, given the health component of both the service provided in long-term care through Ms. Sheedy and also through the paramedic service through Chief Nolan, that has been the sharp end of the stick in COVID. And it has been incredibly gratifying to have had such dynamic leaders that have been in front, not just here in the county of Renfrew, but across the province in demonstrating their commitment and professionalism to the roles they hold. And likewise to you, Mr. Morrow, in at all times keeping the reins firmly in hand that we are continuing to advance the business of the county of Renfrew, notwithstanding all of these challenges that have befallen us. It has been a fairly simple task to be chair of this committee when I'm supported by such outstanding staff and by such an engaged committee. So I wish to thank every one of you for your commitment to this committee for 2020. And here is to hoping that 2021 becomes anticlimactic. So with that, thank you all. I see that we had no closed meeting at the time of the mailing of the agenda package. Mr. Morrow, does that remain?
Chair, yes, it does, sir. Thank you.
Thank you. The date of the next meeting will be at the call of the chair of the Health Committee for 2021. So with that, I would invite the final adjournment for Health Committee for 2020. Councillor Lafreniere, seconded by Councillor Love. All in favor? That is carried. Once again, thank you all for your contributions to this committee this year.